With regard to patients with kidney disease, I think it's kidney disease across the board. Those who have end-stage renal failure have more chance of basically suffering from the severe illness that coronavirus is. In respect of, in my case, for example, I've had a kidney transplant, and I'm on immunosuppressant medication. That results in my immune system being severely compromised and suppressed as a result of the medication. This consequently results not only in the increased chance of me getting coronavirus COVID-19, but also the consequences of getting coronavirus will have a more severe consequence, and given the potential complications that can arise after that, including issues relating to my kidney function as well. So it's not only just getting coronavirus; it's also the implications that getting coronavirus could have, given my kidney disease and my transplanted kidney in particular.
How have you been making sure that you stay safe?
I personally have been in self-isolation, social isolation, since the 16th of March, so coming up to 17, 18 days now. So it's not been that bad, in all fairness. I'm very grateful that I've got very supportive colleagues and partners in the law firm that I work in. I'm working remotely and have been since then. So I actually haven't stepped outside my house since then. And the reason why, obviously, is to minimize any exposure that I have to people who may be asymptomatic but are carriers of coronavirus. And that is the most important thing, reducing the exposure, staying at home, keeping that social distance.
What can people do to help those who might have conditions that affect their immune systems?
As a charity, we have a number of patients, obviously, who are immunocompromised and obviously have had, are on dialysis as well. What we ask really in terms of help from the community is listen to the public health guidance, wash your hands, keep that social distancing, and stay at home. Staying at home is the most important thing. We need to limit the contact that we have, we need to flatten the curve. We need to effectively, as the public health guidance says, save lives at the end of the day. We don't know who's carrying it, so if someone comes out, or someone in my household went out and someone was carrying it next to them, on an inconsequential need to be out, that's what we need. Just keep safe. And from a perspective of people in isolation, reach out to them. Call them up. If you know someone that's isolating, ask them if they need help with their shopping. Ask them, if they need help with cooking. And if literally everything, any little thing helps at the moment.